Several European countries are detecting a rise in BA.2 cases, the subvariant of Omicron. U.S. experts are predicting it could become the dominant strain here in a matter of weeks. ABC 7 News reporter Luz Pena spoke to the senior advisor to the White House COVID-19 response team about what they're seeing across the nation. Luz.
Emma, the U.S. is typically 4 to 6 weeks behind COVID-19 trends in Europe, which is why the White House is keeping a close eye on the U.K. So far, hospitalizations have not increased locally, despite BA.2 being 30% more transmissible than the first strain of Omicron. In the UK, the BA.2 subvariant of Omicron is growing about 80% faster than the first strain of Omicron, according to the UK Health Security Agency. The US is actively monitoring those cases abroad.
We're trying to still assess the ultimate impact, whether people are going to be sick in large numbers there, whether it will increase mortality, but it's concerning.
We spoke to Dr. Tom Inglesby, senior advisor to the White House COVID-19 response team. They're detecting the majority of BA.2 cases in the northeast of the U.S.
We do predict that it will become the majority strain at some point that's circulating. It has not led to an increase in the overall number of COVID cases.
Before vaccines and boosters, an increase of COVID-19 cases led to an uptick in hospitalizations. We spoke to the chief of the emergency department at Zuckerberg San Francisco General Hospital about how the last 2 years equipped them for this new phase of living with COVID.
We opened other floors. We had designated specific areas to manage both critically ill and non-critically ill COVID patients that needed to be admitted. And we now have a template for that. We learned what worked, what didn't work, and we were able to really refine a lot of those processes to be better prepared. So we have those now ready to go.
In the Bay Area, many of the BA.2 cases are being detected in the South Bay, despite Santa Clara being the most highly vaccinated large county in the entire country.
In the northern parts of our county, the wastewater that we follow, most of the Omicron is this B2 sublineage. Interestingly, and this gives me hope, it is not driving up the levels overall. So I don't know why, but it isn't.
During a press conference yesterday, Dr. Sarah Cody, Santa Clara County's public health director, said they are still recommending indoor masking.
There probably will come a time when we're going to need to wear them much of the time if there's another surge.
Dr. Sarah Cody also emphasized that now we have layers of protection, so even if BA.2 is more transmissible than the first strain of Omicron, we have vaccines, boosters, and pharmaceuticals. She said, quote, "We are not going to have to shelter in place." In the newsroom, Luz Pena, ABC 7 News.
All right, Luz, thank you.